Good morning, everyone, and thank you all for being here again on short notice. Let me start off, as I've done in the past, by expressing my appreciation to the supervisor and her fine staff. Every time there are instances where we need an opportunity to share information with the public, I don't care whether we give them 24-hour notice or 48-hour notice, here we are and everything's so well said. Literally, I believe, called Dr. Gamble and Dr. Wilder on Friday and asked them if they didn't mind, please, to come. And as they have done in the past, they carve out time out of their busy schedules, and they're here to share information with everyone. And so let me first announce that on tomorrow, MUSC will once again come to the area and assist us with COVID-19 testing. And of course, the testing is free. It will take place on the east campus of King Street Senior High School. We're doing something a little different in terms of the time. So this time on tomorrow, it will begin at 2 p.m. At 2 p.m. tomorrow, and it will run from 2 to 7. Our hope is that to the extent that we have persons who have to work and aren't able to get off but want to be tested, that they'll have an opportunity after work ends to come and be tested.
Good morning. I promise I will not read all the documents that I have in hand. Senator Sam, again, I want to thank you for affording me the opportunity to share this information this morning with the group. Before I get into information I have, I want to make several announcements, please. We're in the process of planning a virtual town hall meeting that would allow our parents to ask questions and be given answers during the virtual town hall meeting. Hopefully within the next, no later than 2 weeks, we'll have that up and going. I would also like to ask those parents, if you have a child who is 4 years of age or will be 4 on or before September 1st, please register your child for the respective area that he or she lives in, and this will qualify your 4-year-old child to get a laptop, a free laptop to use at home. So, the virtual town hall meeting, please register your 4-year-old child if you've not done so. Now, I'm going to share with you what we're doing as I speak. We currently have 2 types of summer school going on right now. We have our special needs summer school program. This program is for our students with IEPs. This is individualized educational plan. This is a legal document, and a child who has an IEP, we must adhere to that document. And unfortunately, due to COVID-19, a lot of our special needs students' IEPs were not met during the regular school term, so now we're doing those things this summer. We'll begin regular summer school for our regular ed population on July 15th. As I speak with you, those plans are being finalized to begin on the 15th. It will be virtual. We initially planned to do face-to-face, but since DHEC came out with this list of the hot spots and we were one of those orange areas, we could not do face-to-face for our regular ed. So we're doing virtual, and the parents have been contacted and are being contacted in reference to participating in the virtual ed program for this summer. Now, for the elephant that's in the room, what are we doing for this fall? What are we doing for this fall? We've been talking. One thing we do know is that it will not be a traditional school opening. What we're looking at now, and this is very fluid, it could change between now and the time we would like the school to begin. But the first thing we have to address is that for K-5 through 8th grade, we're required to do 5 additional days of instruction. Or should I say, we need the 5 additional days to do assessment around K-5 through 8th grade. And why is this? Well, our students have not been in the classroom, you all, since March 13th. So, the state is requiring that we do assessments for K-5 through 8th grade. And how are we doing this? What we have to do is assess the students in the areas of language arts and math. The assessment will take approximately 3 hours. And what we're hoping to do, we will bring the students in. For the parents who are not comfortable with the children riding the bus, the parents will have the option to bring those students to school. And Dr. McKnight, our Director of Transportation, will get with the principals and other needed staff to finalize a plan as to how do we get those students to school. Why is this important? Because the CDC has issued guidelines in terms of how we can safely transport the students on the bus. As it stands now, and again, this is fluid, it's changing from day to day. As of now, we're saying that students in the same household may sit on the seat together on the bus. Students who are not of the same household will have to be in separate seating. Again, we're working those details out. As a part of the State Department Accelerated Ed Task Force, all those guidelines in this document, and this document is actually on the State Department website, but we also put it on our website so you can see some of the guidelines that we must adhere to. Now, once we get the K-5 through 8th grade students assessed, we have approximately 2,000, maybe 20 K-5 through 8th grade students, and we have to assess those students before we officially begin school for the new school term. How will this look for our 9th through 12th grades? Well, our 9th through 12th grade students will they will continue their 180-day schedule, but K-5 through 8 will actually have 185-day schedule. What we're hoping to do, group, is we're hoping by the time we're ready to open school, and we're looking at a target date of after Labor Day. We will do the assessments beginning the week of the 24th of August through that first week of September. We hope to get all the assessments out of the way. Hope we can get that done. And pending we get that done, then we're hoping to virtually open school for everyone. The worst case scenario could possibly be that we may have a different date for K-5 through 8 versus 9 through 12. Reason being, we need devices for all of our students. Right now, as I speak with you, we have sufficient devices for 9 through 12th grade students. The devices for K-5 through 8th grade on back order. At this point, everyone is trying to get the devices in, and we normally get out of, not normally, we get our devices for Dell. And right now, Dell is backed up because everybody is going virtual. What I'm trying to avoid is I do not want our teachers to have to do paper pencil packets and virtual packets. We are getting input from our parents throughout this process. As a matter of fact, within the past 2 weeks, we sent a survey to our parents. It was online, and they could actually pick up hard copies as well. I would have loved to see more parents complete the survey, but I'm pleased that we did get at least 700 parents completed the survey. And as of now, the survey reflects that parents do not want their students in a face-to-face environment unless we can assure them that they will be completely safe. I cannot imagine. I wish I could say we could do that. We're trying to do this, but I don't think I can assure the parents and the community that we are adhering to all the guidelines of CDC. We actually have the cleansing supplies. We have masks for the students and adults. We're also looking into buying shields for the younger children as well. So, to answer the question, what are we doing to open school? As I said earlier, hopefully, if everything goes as planned, we can virtually open school after Labor Day. The worst case scenario, we may have to have one schedule for K-5 through 8 and one schedule for 9 through 12. That would depend on one other factor. We've discovered that we have approximately 30-35% of our students with no internet access at home at all. The State Department has committed, and thanks to General Assembly, to actually paying for hotspots for these communities. My technology person, Mr. Ernie Young, has really been working very hard around the clock. We were actually meeting with various vendors, getting a cost to possibly do towers throughout the community, but the State Department came in and said, look, there's a possibility, there's a great possibility that we would have funding to, I think it's to pay for at least 6 months of the hotspot services and so forth. So those are the angles that we're looking at. We're trying to open school virtually. We want to make certain that the environment is completely safe. We have several platforms that we've looked at, but the main platform that we've looked at for our K through 12 students is that we're actually trying to do, we're trying to put devices in every child's hand. As I said, we have devices for 9 through 12, sufficient number. The number that we're short of right now will be for the K-5, 8 group. So we're working to get the Chromebooks for that group, and the high school students will just use laptops. We also get a new laptops for the adults and for the teachers. So with that said and done, if there are any questions from the audience, I'll be glad to answer them. But as I said, when we do the virtual town hall, it will give parents an opportunity to ask questions, express their concerns, and if there's anything anyone have a question about today, you can reach me at the district office at 355-5571, or my work cell, 843-372-4862. Thank you.
Thank you, Dr. Father. What I intentionally did not say, and this is another credit to Dr. Wilder and the person that she is, she's experiencing substantial bereavement in her family as we speak. She lost a brother and a nephew over the course of the past couple of weeks, and I told her, I said, Doc, look, we'll figure this out another way. And she says, no, Senator, as long as we're doing it at a time that I can be there, I'll be there. And so, Doc, again, I just appreciate you so much, and our prayers continue to go out to you and your family. One of the things that Dr. Wilder mentioned is this notion of hotspots in some of our areas where we don't have internet access. Many of us have advocated for some time now that we need broadband internet throughout South Carolina and all the rural communities. And one of the things that the pandemic has highlighted is that broadband internet is not a luxury. The fact and the reality is that it's a necessity. And I think it's clear now, and I think the General Assembly has gotten the message that we must have broadband throughout our state. And so we've met, and a substantial portion of the money that we received from the federal government, we have allocated for broadband throughout our state. Obviously, and I want to thank Congressman Clyburn as well for what Congress is doing along those lines, but obviously we can't get it in place in time to start schools, and so then the hotspot notion is what we consider to be a stopgap measure. But please don't think for a moment that we're going to rest there. We won't rest until we've got broadband throughout the state of South Carolina. It's now my privilege to bring Dr. Troy Gamble, our chief medical person at our local hospital, to you now. And again, he's no stranger. I think he's got a lot of credentials behind his name. But I'm going to go out on a limb, and I'm going to say that I think that the two favorites that he has, number one, he's a homeboy. Williamsburg County, grown and reared, and perhaps he might say that our friendship might be one of the others, but we are honored to bring Dr. Troy Gamble for you now. Give me 1 second, Doc. Let me wipe this off for you.
Thank you, Senator. It's always a pleasure to be here. I want to tell the people of Williamsburg County how lucky we are to have Dr. Wilder and Senator Sabb. They are wonderful advocates for our county and for our people in general. And I'm very happy to be asked to be a part of the good things they're doing. Before I get started today, I'd like to announce the hiring of a new Chief Executive Officer for Williamsburg Regional Hospital, Mr. Alan Abernathy, who comes to us from MUSC Florence and will take over from Sharon Poston, who has retired and done a great job for us for the last 8 years, keeping our hospital alive and getting us all odds. So I think we're going to move forward now with Mr. Abernathy, and I look forward to working with him. Today's his first day on the job, so his first order of business this morning was to come with me to this news conference, so we're happy to have him with us. Let me bring you up to date on what we're doing in our hospital for you, the residents of Williamsburg County, right here at Williamsburg Regional Hospital. We have our 4-bed ICU open and fully functional. Through the generosity of people in this community, we put closed doors, glass doors on all of our ICU rooms so that we can use them as isolation rooms as well as ICU rooms, and it created a negative pressure environment there as best we can. We have available to you everything that would be available to you in any major medical center. We have ventilatory support, we have ventilators, we have respiratory therapy. We have joined them with the state, and they are supplying us remdesivir, which is a new antiviral that's made by the Gilead Corporation, that it seems to be working very well for most people. We've had some really good success stories treating people with IV remdesivir for 5 days. We've gotten some wonderful recoveries from some people who were very sick that even stopped them from having to go on the ventilator. We're also giving the convalescent plasma. We have joined a study with the Mayo Clinic in order to provide that, and that seems to be working as well. Not as well as the remdesivir, and the data's still out on how well or not this works. We're also giving the Decadron that was found, it's an anti-inflammatory steroid that was found. In the British literature, the outcomes were so much better with people who received Decadron 6 milligrams daily that they stopped the placebo wing, because outcomes were so much better with the people on steroid wings. So we actually have that available to our patients as well. Senator Sabb asked me to comment and share my thoughts a little bit about school openings and the safety or the lack thereof of the safety. Before I jump into that, let me say that I told Senator Sabb the other day this was probably one of the toughest decisions that our legislative body and our educational personnel like Dr. Wilder will have to make. I'm reminded of a sign that hung in the gymnasium where I grew up in Andrews, that was put there by Coach and then Principal Weber Rao. It said, "Those who can do, those who can't criticize." And from my part as a medical professional who tries to stay relatively apolitical, I will tell you that there are no good answers. To the parent who wants their child to be guaranteed to be 100% safe, there are no guarantees for that. That's an impossible guarantee. This is an infectious virus. It is very infectious. The good news is that 99% of children get well with this. They don't get as sick as adults get with this unless they have some underlying pathology with it. Things like asthma or other things, immunocompromised type diseases that put them at risk. Children with sickle cell, for instance, do poorly with this. So there has to be some common sense in who comes to school and perhaps who doesn't, about who takes school virtually and who doesn't. It's a very complex issue. Many of our students in our county depend on school for some of their meals in a day, and also so that their family members can work. One of the most devastating things that this virus has done is that it has put people in the unemployment lines. And as you know, we in Williamsburg County, and I go back 7 generations here in Williamsburg County, we in Williamsburg County have had some of the poorest, lowest, or highest unemployment rates in our state for a long, long time. We have some of the highest infant mortality rates of anybody anywhere. And so that's why all of us, Senator Sabb, myself, and everybody at Williamsburg Regional Hospital, our board, has worked desperately to keep our hospital open to provide access to our local people. Because the further you have to travel, especially if you're critically ill, the less likely you will live. With that said, what do we do? Is the answer no school this year? That's the way to keep the most number of people healthy. But if you go no school, then who takes care of the children during the day when mom and dad are working? Those are things that have to be considered. And so there have to be some tough decisions made. When I was a child, there was a polio. Polio was going around. You could be paralyzed, you could stop breathing, you could end up on an iron lung. We didn't have ventilators back then. And people ended up on an iron lung. My next door neighbor got polio. They quarantined us for 2 weeks and sent us back to school. We're now taking a different approach to infections. Here's an infection that has a 97 to 99% recovery rate, depending on who you believe. And yet we're closing businesses, closing schools, running around crazy, and for good reasons. The people that get this and get very sick are very sick. I had a patient that passed away this morning that had an underlying disease. We gave her everything available. It did not work. And so it's a very helpless feeling to feel like there's nothing else you can do. So these are very, very difficult decisions that have to be made about school openings, how the children are going to be protected, what we're going to do. And I think Dr. Wilder has already shown you this morning is a very thoughtful, very thoughtful, very tedious process that they're going through to try to protect your children. The only thing I can tell you is that most of your children will be okay even if they get it. Remember, Dr. Fauci told us, he's probably the world's expert on coronavirus. He told us very early on that this infection, you cannot stop the spread of it. What we're doing by isolating and wearing masks and social distancing is reducing the transmission of it. Instead of having a big curve, it flattens out the curve. It makes the curve last longer. The more we flatten the curve, the longer it lasts. That's a mathematical probability and truth. These are facts. I try to stay with facts. And so even though we can reduce the spread is going to continue. And so it's going to run through the schools. I can tell you it will run through the schools because people outside are not doing what they've been asked to do. People are not wearing masks. They're not social distancing. I was amused right here at one of our stores, like a Dollar General or a Family Mart or whatever they call them. It was announced in the community they had Clorox. There was a line around the side of the building. Everybody was standing in line. People were talking and laughing. Nobody had on a mask. Nobody was social distancing. That's how this virus gets spread. Most children are going to get well when they get this, but the risk is they're going to go home and infect grandmama and granddad. Or me. They're going to go home and infect me. I'm your only full-time doctor that runs this hospital over here that provides the kind of care that we're providing for these patients. If I go out, what are we going to do? And yet, I passed through Georgetown on a boat behind Georgetown, and I noticed people in several of the restaurants there that were all on social distancing. None of them had on masks. I would implore you, if your child gets it, please put a mask on him, put a mask on you, social distance at home, move grandma and granddad somewhere else, let them stay with somebody else and quarantine until this passes. That's going to be the risk of starting up school. The other thing is you've seen big upticks in the numbers here. When they were asking us to close all our services down, we had one case in Williamsburg County. That was because it hadn't gotten here yet. Now the cases are exploding. I would bet 50% of the people that we're testing rapidly in the hospital for various reasons, 50% of them are positive. The good news is about half of them aren't very sick at all. In fact, most of them, in fact, almost all of them are going back home and self-quarantining at home. So some of the big uptick you're seeing and some of the uproar is sensationalism and it's not based on fact. We have seen an uptick in the number of people in the hospitals, and Dr. Fauci tells us that's the critical part here. No matter what these people decide for you about your schools, please work with them. We have enough division in this country already. Let's come together and support these folks who are trying to make the most difficult decisions of a lifetime. This pandemic is something that has not occurred in over 100 years. Let's not be so critical of one another. Let's support the best efforts. Sure, we're going to make mistakes. Sure, there are going to be people getting sick. Sure, there are going to be people die you didn't want to die. But that's the nature of this. We cannot stop it. The good news is we do have some treatment now that's turning a lot of these people around that would have died otherwise. We at least have some treatment now. The media is not telling you that, but we at least have some treatments that seem to be working. And so, please wear a mask. Please social distance. Please work with your legislators and your people in education. They are trying to do their best for you. One, to keep you at your job while your children go to school, and yet keep them safe. There's going to be some breakdown in it. We're humans. We make mistakes. Let's forgive one another for the mistakes. Let's recognize everybody's trying to do the best they can in a very difficult situation. And stop fighting at one another and attacking one another, because we're all doing the best we can. Remember, I have to come to work every day. I have to do this every day. I can't social isolate. I get exposed every day. That's why I'm standing here wearing the mask, even talking to you, because I may have it now, and I don't want to blow it out there on y'all, because I get exposed every day. And I've been doing this, we're 4 or 5 months into this thing. Knock on wood, I haven't gotten infected because I dress up like an astronaut when I treat these folks. But I just want you to understand that there are those of us, teachers, doctors, people that run essential businesses, we're on your front lines every day. We love you. We do it because we care about you. And I just hope we can all work together and not be so critical of one another in these very difficult times. Thank you for your time. If there's any questions, I'll try to answer them for you. Otherwise, thank you for having me as always. And I love Williamsburg Hospital and I love Williamsburg County. Thank you.
Thank you. Good morning. Thank you for having me. My name is Alan Abernathy. I am the new CEO of Williamsburg Health. As Dr. Campbell said, I've been on the job for about 2.5 hours now. I had the pleasure to come to my first press conference right off the bat here. So I'd just like to say, being new here is I've been very welcomed in this community, and I look forward to working with this community. I'd like to just mention one thing that Senator Sapp mentioned, which are the woods being thick. And how we typically find our way out of the woods is with the compass. That compass points north. And Williamsburg Regional Health is going to do the same exact thing. We're going to follow our true north, follow the compass, which is the health and well-being of this community. So with that, I was just going to agree and say thank you for having me. Thank you.
So I wanted to hold all the questions until the end. I don't know whether or not there are any questions from the media or good to see our supervisor here. Thank you so much for what you did. I thanked you earlier in abstention. But we appreciate you and all your staff have done each and every time that we've called upon them.
Please share this video